All right. Good morning, everyone. My name is Dr. Piyal Alam. I'm one of the Northeast Medical Group's family medicine doctors. I'm also one of Greenwich Hospital's community doctors. Our office is located in Rye Brook, New York. Today, the topic that we'll be covering is how to identify common upper respiratory ailments. And for a general overview, we'll be covering the common cold, a little bit of COVID-19, the flu, and allergies as well. And for each topic, we'll be covering what causes them, what are some symptoms, some general treatment recommendations, and what preventative measures we could take to try to help prevent them from happening. And what we'll be seeing throughout all of the topics is some repeating themes, some repeating recommendations. Again, even though it may seem overlapping, they're all very applicable, and the high yield stuff we'll be hearing over and over again a few times. So thank you for bearing with me. So for the presentation, I've also made a small PowerPoint to just help guide us, but it's just a skeleton. For the most part, I'll be talking a lot, and I'll be showing you a few tools that we could use as well. So without much further ado, let's get started. So in order to do that, I'll be sharing my screen. So please bear with me. This is my first webinar. So let's see right here. Perfect. So right now the screen is being shared. I'll press present. And here we go. Okay, so at this time, I'll likely be a small little icon on your side, and you should be able to see the PowerPoint. And again, for the most part, there'll be just a few questions up there, and I'll be speaking. If you have any questions throughout the presentation, please feel free to use the Q&A section. After each slide, I'll try to take a look and try to answer them throughout. But otherwise, if I don't get a chance to answer it, I'll definitely leave some time at the end to try to answer them. And if anything, please, I'll respond with emails as well. Alrighty, so just a little brief introduction of myself. And these are the goals for today. We're reviewing the common cold, influenza, COVID-19, allergies. We'll be looking at some key similarities, some key differences, some tools that we could use, preventative measures, and a little summary. Alrighty, so before we get started, the respiratory system. We could think of it in terms of two main parts, the upper respiratory and the lower respiratory. The upper respiratory, you could think of it as your ears, then to your nose, then to your sinuses, and then to your throat. At this point is the transition point where we go to our lower respiratory. With our lungs, our both lobes, our right, our left, and each lung actually has multiple sections as well. So just for today, we're gonna focus mostly on the upper respiratory. Usually when we get ill, it starts from the upper respiratory and starts transitioning down to the lower respiratory tract. All right, so let's get started with the common cold. All right, let's start with what is it and what causes them? So the common cold is one of the most frequent illnesses in the United States, and most colds are usually relatively mild and short time period. And so it doesn't really cause like severe symptoms. However, it does cause a lot of Americans, all of us, to take time off from work. So it does become a costly illness. So definitely best if we could avoid them. So what causes them? Most commonly, colds are caused by the rhinovirus. This causes the greatest number of colds. There's also other viruses like adenovirus, the para-influenza virus, and things like that. But the rhinovirus is by far the biggest culprit. Again, doesn't cause severe symptoms, but it has many variations and strains. So what happens is you'll get the virus, it'll start growing in your body. It takes about 1 to 2 days for it to grow, and then you start showing symptoms, and the symptoms can last anywhere from 5 to 7 days on the shorter end of the spectrum, up to even 2 weeks sometimes. And usually we're contagious pretty much 1 to 2 days prior to having the symptoms, and then for the whole duration of when we do have the symptoms. This is unique for the common cold. And the average adult will get about 2 to 3 colds per year, and a healthy average child will usually get 8 to 12 colds per year. And how are colds primarily transmitted? They're usually transmitted from person to person from hand contamination and nasal secretions. So what happens is, say I have the cold, I have a runny nose, I wipe my nose with my hand, which I should not do, and then accidentally touch a surface and someone else touches that surface. They might get the full cold from there, and then they touch their nose. That's how they usually get the cold. On our hands or any human skin, the common cold virus can survive for about 2 hours or so. And then say we sneeze and our nasal secretions goes on like the desk or a table or a doorknob, it can usually survive 2 to 3 hours as well, similar time frame on surfaces as well. Otherwise, the common cold viruses, they die without a host. Okay. A few important key points to know is that most cold viruses are not spread by saliva, so kissing really won't transmit it, and the cold weather does not cause cold. It may cause immunocompromise that may make you more susceptible, but cold weather and cold climates themselves do not cause the cold. So what are some of the common symptoms that we see with colds? Mostly we see a lot of nasal congestion, runny nose, clear mucus secretions, and sometimes initially we'll see a sore throat in the first few days. And then later on, if the sore throat lingers, it's usually because the runny nose, the secretions are going down and irritating the back of the throat. And that's what's causing the cough, the sore throat, and that's very unique. The cough really doesn't come from the chest. It really comes more from irritation of the throat. So that's a very important distinguishing factor for the common cold. And again, like we were saying, in most cases of the cold, they're not very serious. On the shorter end of the spectrum, 3 to 7 days of symptoms. On the longer end, about 2 weeks. However, sometimes people's immune system can get depressed by the cold, which could lead to secondary, more dangerous viral infections or a bacterial infection affecting our lower lungs. So very important to try to nip it in the bud early, taking interventions and treatment recommendations that we'll be talking about a little bit later. Okay. Actually, you know what? Let's start talking about them right now. What interventions can we take to try to help treat and control cold symptoms? So there's no specific treatment to make it go away. However, there are things that we could do to try to ease our symptoms and boost our immune system to try to help our body fight it off itself. So first thing to understand is with any virus, any viruses, no antibiotics work on them, because antibiotics are designed to get rid of bacteria. However, the way a virus is composed and created, made, unfortunately, antibiotics do not work on them. If anything, antibiotics could actually get rid of our good bacteria in our intestines, sometimes cause diarrhea, cause issues. So if you suspect you have a common cold or a virus, try to avoid antibiotics. And this is where consulting your physician or your healthcare clinician is very important. So for our runny nose and nasal congestion symptoms, what can we do? Excuse me. So for the runny nose, there's a few things, natural things that we could do, like warm steam showers, using a humidifier at night, even gently massaging our sinuses. In terms of medications, your doctor may recommend an intranasal mild steroid like a Flonase or something like that. And what that does is it helps decrease the swelling in your sinuses. So that'll make it feel, less secretions, less runny nose, less sore throat, coughing. So that's medication that can help. For headaches, you could take Tylenol or ibuprofen. Again, consult your doctor before making that decision. For cough, there's over-the-counter cough suppressants like Robitussin, with the DM component especially. That component is a nice cough suppressant. And then again, like we said, no antibiotics, and a few alternative treatments that could help boost our immune system without much harm is like vitamin C, and then also zinc is another element that really can help as well. So over-the-counter supplements can help with that. And now, what preventative measures can we take? So the first thing we could do is hand washing. It's highly effective, helps prevent spread of the infection. You could use just plain tap water with soap, making sure to lather with the soap for 15 to minimum like 20 to 30 seconds, and then washing it off. If that's not available, using alcohol-based hand sanitizers are great as well, making sure that there are at least 60% alcohol component to it, and then that's a sufficient alternative. Other lifestyle things that we could do is making sure we wash our hands before we prepare food, before we eat, after we cough, after we blow our nose or sneeze. If we are to be sneezing into our elbows is very effective as well. That way it prevents the spread of spores. And those are the main interventions that we could take. And again, I believe I may have said this earlier, but most of us are contagious about 1 to 2 days prior to symptoms onset and while we're symptomatic for the common cold. All right, so that is a nice little general overview of the common cold. I'm just gonna stop really quickly to see if there's any questions. Nope. All right, perfect. All right, and now we're gonna get to COVID-19. This is the one I wanted to touch base on first, just because it's very prevalent. It's all on all of our minds with everything going on with the pandemic. So I'd like to talk about this topic next. So what is COVID-19? So it stands for Coronavirus Disease 2019, caused by the SARS-CoV-2 virus. And this is a novel, meaning new variant of the traditional coronavirus and what potentially caused it. There's a leading theory that there was a new variation of the coronavirus that may have jumped from a rare animal called pangolinium to humans. Our immune system really wasn't used to this, didn't know this variation. This is why we have such severe symptoms for some people, and why it's a little more dangerous than the traditional coronavirus that we had in the past. So how is it spread? The virus is mainly spread from person to person, usually when an infected person coughs, sneezes, or talks near other people. What makes it especially contagious is because it could be a lot of spores, and what we find that in the droplets, and the virus can survive anywhere from 2 hours up to, some studies have actually even showed up to even 7 to 9 days even. So it's very important that we clean our surfaces and whatnot, and especially if we're sick, quarantining as much as possible. So the virus, this is also one of the reasons why the virus can be easily passed between people who live close together. It could also be spread at gatherings when people are talking close to each other, shaking hands, hugging, sharing foods. Restaurants, you're at a little bit higher risk just because people tend to sit very close to each other. People also don't cover their faces when they're eating. They take off their masks, so another chance of spreading. A person can even be infected and not even show any symptoms and really be still spreading. What we've been finding is people asymptomatic, almost even 4 or 5 days before they start showing symptoms, actually may have the virus brewing in them and can actually still be contagious. And then for the most part, people stop being contagious about 10 to 14 days, usually after when their symptoms first started from. So about 10 days from when your symptoms first started to 10 days, that's when you're really the most contagious. All right, so what are some of the symptoms associated with COVID? We may have touched on it a little bit before. Symptoms usually start 4 to 7 days after a person is infected from the virus. So you have that little silent period. It can take up to 2 weeks sometimes for some people to have symptoms appear. So the silent period may actually even be longer for some people, usually with the younger people. And again, some people never even show symptoms at all. Again, this usually tends to be the younger population. So some of the higher risk symptoms of COVID that we see in a lot of our patients is high fevers, difficulty breathing. That's really unique. Very hard time breathing, a lot of shortness of breath, and then a chest cough. Unlike the common cold, where the cough usually originates from like the neck, the throat, the COVID cough usually originates from the chest. A lot of my patients tell me usually from the back of their chest. And that's consistent with X-ray findings and things like that as well. A few other symptoms that we see are like shaking, chills, muscle ache, headaches, again, sore throat, again, a few overlapping symptoms. A few atypical, unique symptoms that we see in younger patients with COVID is a complete loss of smell and taste, nausea and diarrhea sometimes, and oddly enough, some reddish purple like rashes on fingertips and toes. Not too common, but if you ever notice something like that, definitely speaking with your doctor, getting tested may be very beneficial. So a question a lot of people ask is, am I at risk for getting seriously ill, at a risk of getting the higher risk symptoms for COVID? And it really depends on your age and your past medical history and health in general. Oftentimes, the people that will, the serious problems associated with COVID is usually pneumonias, blood clots, and not getting enough oxygen, and heart problems. So the higher risk population is really our elderly community, as well as people with a past medical history of like heart disease, chronic kidney disease, type 2 diabetes, COPD, which stands for chronic obstructive pulmonary disease, as well as sickle cell and obesity as well. So those are some higher risk factors to just keep in mind. Okay, so what interventions can we take to try to treat? So very important. If you feel like you're having any symptoms or have any concerns for COVID, the first thing to do is definitely talk to your doctor or a healthcare clinician. Addressing your concerns, just talking about it can sometimes ease our mind. And also, of course, getting COVID tested may be an option as well. But general treatment things that we could do at home for any type of viral illness is, one is drink plenty of fluids, making sure you're making good urine, so that to help prevent dehydration. Deep breathing exercises where we breathe in over 4 seconds, and then we breathe out over 6 to 7 seconds, multiple times throughout the day. And what this does is helps keep the lungs open, nicely aerated, nice oxygen, nutrition gets to the lungs, and helps prevent like a bronchitis or pneumonia. And then finally, again, based off your allergies, talking with your doctor first, Tylenol, Advil may be good over-the-counter options to try to help control fevers. Okay, so can COVID-19 be prevented, and what measures can we take? So experts are working on the COVID-19 vaccine, and I'd like to say I was very fortunate to be one of the first few people to get the COVID-19 vaccine at Greenwich Hospital on December 16th. And then I actually received my second dose last week. And thankfully, as you can see, I'm doing well. So it's relatively safe and hopefully should be relatively effective. Hopefully this could be the beginning of the end of the pandemic for us. So very hopeful and very thankful to everyone, all the scientists that have been working on it, and Greenwich Hospital for starting to implement it and spread it throughout our community. So again, I would recommend talking to your doctor first, discussing your personal medical history, your allergies, and then making a educated medical decision together. And the vaccine may be a good option to help trying to prevent this. Otherwise, until then, what can we do? A lot of people know now. On the CDC website, you could check as well. A few things. First off is practicing social distancing, avoiding contact with people who may be exhibiting any symptoms, staying away from crowded areas, wearing a face mask if we have to be out in public, trying to maintain at least 6-foot distance from people in public if possible, and making sure that our mask is actually covering our mouth and our nose fully. That way we know for sure it's being contained. And then of course, washing our hands with soap and water, like previously, again, 20 seconds at least. And then again, another alternative, the hand sanitizer is very useful as well. Another thing that's very hard to do sometimes, because we do it a lot subconsciously, is avoiding touching our faces, our mouth and noses especially. As you can see, I speak a lot with my hands, and sometimes my hands get close to my face, so that's something I have to work on personally as well, but trying to avoid that. And then finally, avoiding unnecessary travel. If we could limit our traveling, at least until the pandemic is under control, we could limit our chances of potentially spreading the virus. Okay, so those are the main high-yield points on coronavirus I wanted to share. So I'll just zoom back out again and check really quickly if there's any other questions. No, perfect. So now we'll move on to influenza next, our seasonal flu that we know well. See how we're doing on time. Perfect. So what is the flu, and what causes it? The flu is an infection that can cause fevers, cough, body aches, and it's usually caused by the influenza virus. The virus can have certain variations from year to year, but typically speaking, in broad terms, it's usually type A or type B. Type A usually gives a milder set of symptoms, and type B tends to give a little bit more severe symptoms. Again, type A is much more common. And excuse me, and the symptoms that are associated with it. So again, what's unique about the flu as opposed to COVID or the common cold is that all the symptoms tend to hit you all at once. Like almost like people, a lot of my patients say it feels like they got hit by a brick truck or something like that, like all at once. They were completely fine, and then within 15 to 20 minutes, like their symptoms all came all at once. And the symptoms include extreme fatigue, tiredness, headaches, body aches, usually the shoulders, fevers, cough, runny nose, everything all at once suddenly. So that's a very unique distinguishing feature that we see. So is the flu dangerous? Most people get the flu. For most people, it's really not too dangerous. Again, it's very similar in the fact that people with prior medical conditions like heart disease, diabetes, immunocompromised at a little bit higher risk. And as opposed to COVID, the most severe symptoms happen on both ends of the spectrums for the flu. So for our senior population, ages greater than 65, and our younger children, usually ages under age 5, so or especially under age 2. So they're the ones that they seem to have the most severe of the symptoms from influenza. We also say to take extra precaution with pregnancy as well. They're at a little bit of a higher risk than the general population. So definitely being cognizant of that is very important as well. So what interventions can we take to treat the flu? So similar to COVID, we have I'm sure everyone knows, the annual influenza vaccine. The reason why it's given annually is because scientists study trends and data and try to predict what will be the greatest strains of the viruses that will potentially cause flu this year. Generally speaking, they're anywhere from, on the lower end of the spectrum, sometimes 55 to 60% accurate, up to 75 to 80% accurate. Even regardless, even on the years that it's not as accurate as predicting it, the flu vaccine still makes it less severe the symptoms that you experience if you get the vaccine. So say if you were to be, normally you'd be sick for 2 weeks, you'd probably be sick for only 7 days. But really the most important is our higher risk population people as well, our children and our senior population, because it could potentially be life-saving, because it could be the difference between having to go to the hospital because of the flu versus being able to treat it at home, which is much more ideal. And in terms of at-home treatment recommendations, just like COVID, it would be drinking plenty of fluids as you could tolerate, deep breathing exercises again, and again, after consulting with your physician, taking Tylenol or Advil as needed. And another thing I forgot to mention is there's actually an antiviral medication for the flu. Like you may have heard of the Tamiflu. Again, it doesn't get rid of the flu, but it stops it from keeping growing. So instead of you experiencing symptoms that'll last for 1 to 2 weeks, maybe perhaps you'll just experience the symptoms for a few days as your body naturally fights off the flu and it can rids your body of it. All right. And now, how can we protect ourselves from the flu? Again, very similar to COVID, very similar to the common cold, washing our hands with soap and water, at least 20 seconds, using our hand sanitizers, staying away from people that are potentially sick, exhibiting symptoms, wearing our mask in public, and again, getting our annual flu vaccine as well. All right. That's a little overview of the flu. And now a little, a potential chameleon, allergies, our seasonal allergies, can sometimes present like virus-like symptoms, but not necessarily the case. Alrighty. So what causes allergies and what is it? So seasonal allergies are a group of conditions that can cause sneezing, stuffy nose, runny nose, itchy eyes, watery eyes, but a very distinguishing factor is that it only happens at certain times of the year. And the reason why we get seasonal allergies or any type of allergies to certain items is because our own immune system thinks the substance that we've breathed in to be harmful to our body, although it may be just relatively benign, like just dust or anything like that. However, our body perceives it as a threat and starts getting into action mode and starts exhibiting all these symptoms. So what we'll notice in a lot of people is they'll have seasonal allergies lifelong, usually starting when they're younger, but that, people definitely can develop them later on in life as well. And a very unique thing is that we see that it happens at certain times of the year, certain triggers. Very commonly in the springtime, we see tree pollen causing it. In the summertime, grass pollen. In the fall, we have weed pollen. And the wintertime, we see mold cause it as well a lot. Other big culprits that we know of are certain types of insects, dust mites, cockroaches sometimes, animals such as cats and dog, cat dander, and of course mold spores as well. So what are some of the symptoms of seasonal allergy? So very similar to the common cold, people tend to get a stuffy nose, runny nose, a lot of sneezing, a lot of watery eyes, a lot of itchy eyes. That's a unique feature of the eyes. Sometimes you'll get sore throat. Again, this is from that postnasal drip. So it can sometimes mimic the common cold a lot. However, a few distinguishing factors is it usually happens around certain times of the year, and also the itchy eyes and red eyes component as well. All right, so is there like tests for seasonal allergies? Yeah, certain specialist doctors, allergists, can definitely do skin testing to see if you're allergic to certain products. Also, there's some blood tests as well, checking for IgE antibodies and things like that. But definitely there are ways to diagnose it, and sometimes we do exclusion testing where we try to remove ourselves from certain environments and see if our symptoms improve. And a lot of times that's how a lot of people diagnose themselves as well. So How are seasonal allergies treated? So a few things that we could do, mild things to start, is nose rinses, especially because our noses tend to get very stuffy, clogged. Rinsing the nose with saline water. I'm sure you may have heard of things like neti pots and things like that. That can be beneficial. Again, all natural ways, warm steam showers, using a humidifier at night, and again, massaging our sinuses can be very useful as well. Okay, and then in terms of the medication front, a doctor may want to recommend like an intranasal mild steroid, like a Flonase, to just help decongest it, shrink the sinuses a little to decrease the secretions and whatnot. Other things that sometimes doctors recommend is antihistamines. It's because usually our body has this histamine reaction, which is causing this allergic reaction. So the antihistamine works to try to combat that and calm the body down. So it helps stop itching, sneezing, the runny nose. Sometimes there's antihistamine eye drops also for red eyes, for watery eyes, itchy eyes. Also, decongestants are okay as well sometimes. Doctors recommend it. And if your allergies are very severe, allergy specialist doctors may actually give injections and shots. And those are very individualized and unique to each person. So definitely consult your doctor before considering something like that. So what can we help prevent seasonal allergies? And for the most part, the answer is yes, if we're able to correctly identify what might be triggering it or causing it. So if you notice that every spring you start getting itchy eyes, watery eyes, sneezing, it may be beneficial to consider starting, an over-the-counter antihistamine 2 weeks before that time. Or your doctor may recommend something else along those lines as well. Additionally, just if there's dust, making sure that we sweep the dust, making sure our environment's nice and clean can definitely help. Avoiding triggers as much as possible. If you notice certain time of the year, you're getting symptoms, maybe staying indoors during those times of the year, or if you have to go out wearing a mask, keeping our car doors and windows closed during difficult times of the years as well. And then another important thing that we could do is before we go to bed, showering and washing our body, our hair, and wearing a fresh set of clothes before we go to bed can be beneficial. That way we're not rolling in some type of pollen or anything that may potentially trigger the allergy. All right. So those are some of the main points I wanted to touch base on with the allergies as well. Before going on, I'm just going to take another quick look to see how we're doing on time. Very good. Let's see if there's any questions. All right, excellent. And now let's touch base on some similarities. So a few, so far we've covered the common cold, COVID, the flu, and allergies. And some key similarities, minus the allergies, is that these three things are viruses. And a very important fact to denote is that antibiotics do not work on them. And if anything, they could make things worse. So trying to use other alternative measures to try to treat them is ideal. A lot of them can have overlapping symptoms, so seeking medical advice, evaluation is very important as well. And a few things that we could do is drink plenty of fluids, practice our deep breathing exercises, and then taking public health precautions. Again, washing our hands for at least 20 seconds, using our hand sanitizer, at least 60% alcohol-based, wearing a mask when we're in public, and self-isolating ourselves when we're feeling ill. Okay, and some key differences is one is actually timing. So the flu, we'll see a sudden onset of all the symptoms all at once. We could be feeling completely fine, maybe even at work, and then all of a sudden we just get hit with like extreme fatigue, extreme exhaustion, body aches, start feeling shivers, chills. That may be a good indication that this may be the flu. And then afterwards, COVID and the common cold has a much slower progression. Usually, again, the common cold, you may it may take 2 days for you to start exhibiting symptoms, and then and COVID would usually be about 5 to 7 days silent period. And another big difference is COVID associated with difficulty breathing, lower respiratory symptoms, a lot of shortness of breath, pain, cough, usually again originating from the back. So definitely looking out for that symptom. Allergies tend to repeat at certain times of the year, remembering that. Flu vaccine is annual, new strain every year. COVID vaccine at this time is being implemented. And then for the common cold, there are no vaccines. So I actually noticed, I think we may have 2 questions, so I'll take a chance to look at it, please. When we start to take temps, coughing associated with allergies. So in terms of so I'm sorry, I didn't understand the first question too well, but just to answer the second question, is cough associated with allergies? Great question. It presents in a very similar fashion for some people as it with the common cold, where the cough from allergies can happen when you have a postnasal drip, a runny nose, instead of coming down the front, goes down the back of your throat and kind of irritates your throat and settles back there sometimes. And then that could cause coughing symptoms. And it feels like the cough is coming from the throat because of irritation, agitation, itchiness in the throat. So that definitely can cause coughing symptoms for allergies. A way to combat that, again, is trying to control your sinuses. And sometimes, again, doctors will recommend intranasal mild steroid, but again, warm steam showers, massaging our sinuses can be very beneficial to try to help the cough. Okay, so a good question. Doctors always ask about colors of weird secretions all the time, but this helps us sometimes figure out a diagnosis. So I'll definitely share that with you now. So there's like a broad spectrum. Again, it's not like a steadfast rule. I'll just stop sharing the screen now. Okay, so in terms of the color spectrum, most of the times, if it's a viral infection, it'll be on the clearer end of the spectrum, clear to yellow sputum, just because of secretions that kind of pool overnight, can sometimes even go on to greenish. However, once the secretions start getting much darker in color, like a dark brown to gray, usually associated with a foul odor, that's when we're starting to go towards the bacterial end of the spectrum. And this is where antibiotics may potentially be indicated. But again, it's just guidelines, not a steadfast rule. Again, this is why getting a physical examination, physical evaluation, sometimes even blood work is necessary to make a definitive diagnosis. But this is why a lot of doctors like to ask about the color of the secretions, because it starts pointing them in a certain direction. But again, it's not a steadfast rule, but great question. Okay, so with that being said, the next topic I wanted to talk to you about was some tools that we could use. And I stopped sharing the screen, so hopefully I'm a little bit bigger on your screen now. I wanted to share some of the most useful tools that we could have at home that could help guide us. So one of them is a thermometer right here. This is an infrared thermometer that I'm sure at a lot of facilities you see used. This is great, works relatively good. Under the tongue thermometers are excellent as well. Those are really the best for the outpatient world. And one of these infrared thermometers are great, but an under the tongue thermometer is even more accurate sometimes. So I'd definitely recommend that. Another very useful tool that a lot of people, I guess, more are learning about now, but can potentially help save a life, is something called a pulse oximetry machine. So it looks like this. I'm sure when you go to the doctor's office, they put it on your finger. What this does is it checks your heart rate and your oxygen level. So let me see if I could see my own. and it can really help guide you on your decision making. And if you have this and you have a televisit with your doctor, that could really help. It could show you what your heart rate is and what your oxygen level is. It's kind of hard to see right now. I'll bring it a little bit closer. As you can see, my oxygen right now is 99% and heart rate is around 100, so a little bit on the higher end of normal. So a normal person's heart rate is anywhere from 60 to 100. Sometimes it can go a little higher as well. And a normal oxygen level is between 100 to 92%. We usually, all humans tend to aerate, like have oxygen enough, relatively strong, good amount, up to as low as 92%. It's relatively okay. But once it starts dipping below 92% is when we start getting more concerned that person may need some more respiratory support. They may need some supplemental oxygen. So if it ever dips below that, that's when you definitely want to consult with your doctor or get evaluation. If it ever dips below 89%, that's potentially a medical emergency. So definitely getting urgent or immediate evaluation may be indicated at that point. So again, it's called the pulse oximetry machine, a very useful tool. Most pharmacies have it. I'm sure you could get it on the internet as well. It may potentially help save a life. Actually, one of my patients I gave this to about 2 weeks ago called me last week, and it actually helped guide us and get him the appropriate treatment. Knock on wood, help save his life. So definitely something to consider. And of course, a few other tools. Of course, a little handy dandy hand sanitizer. Keeping little ones like this in your car may be useful, in your pocket as well, just in case you ever need it. And of course, the good old mask. I'm a New York Giants fan, so you could represent your favorite sports team or whatever you'd like. Wearing a mask the proper way, making sure that your nose is completely covered and your mouth is completely covered, not much space or anything like that. A lot of times I see, masks slip down like this. It's really ineffective at that point. So making sure the bridge of your nose are here completely covered, very important. And then these are washable. So after using a mask, ideally you'd want to wash it every time. And then of course there's just one-time use disposable masks as well. I think there may have been a question. Okay, what does it mean when different fingers get different pulse ox numbers? So that's a great question. So that may potentially mean that a certain finger is cold. Like my fingers are actually a little cold right now. So, really it should be one same number throughout the entire body because it represents your oxygen number throughout your whole body. So ideally, it shouldn't be different numbers on different fingers unless a certain finger is cold. So a lot of times we'll recommend that you warm your hands fully before you do it and whatnot. And if it's too low, it's likely potentially from a cold finger. So great question to ask. So thank you for that one. Yeah. Okay. So that was one of the tools. Okay, so perfect. So I'll just share the screen again. We're almost near the end. So again, just for summary, thermometer, if anyone wanted to write it down, pulse oximetry machine. All right, masks, soaps, and hand sanitizers. So what can we do? General interventions. Again, if we have any questions, concerns, see your doctor or trusted healthcare professional, devise a personalized medical plan, general public health tips, wearing a mask when in public. If you're ill and live with others, may consider wearing a mask at home as well. So that's a great point I forgot to mention. Say that you're at home and you're the only one that's ill, but the rest of your family members or roommates are doing relatively okay. It's okay for you to wear a mask at home, recommended. Also try to limit your interactions with them if you could. Potentially eat food from your own room. Totally understandable that it's hard to do sometimes. And again, for mental health purposes, interacting with our family members is very important as well. But limiting it as much as we potentially can is beneficial. Keeping your own glass, keeping your own plate, your own utensils is very useful as well, again, to minimize overlap with others. Again, washing our hands thoroughly with soap and water, at least 20 seconds. May use hand sanitizers, at least 60% ethyl alcohol. Maintaining 6 feet social distance in public. Try to minimize any large gatherings, minimize travel, non-essential travel, and minimize it to only essential travel, like getting food and whatnot. Okay. In final summary, again, viruses, antibiotics do not work on them. There's multiple overlapping symptoms with the cold, COVID, flu, allergies. It can get tricky and confusing. If ever you feel overwhelmed, definitely touch base with your medical doctor for evaluation. Drink plenty of fluids, practice deep breathing exercises, and for the deep breathing, again, it's breathing in over 4 seconds, and then breathing out over 6 to 7 seconds. Again, it helps move things along in your lungs, helps prevent like a bronchitis or a pneumonia, and ironically, it actually has excellent mental health benefits as well. It helps calm us down, releases relaxing hormones, makes us feel much calmer and less anxious as well. And finally, the public health precautions. I think I've said it too many times already today, but very important. Washing our hands, mask use in public, self-isolation when we're ill, and those are the main points that I wanted to make. So thank you again, everyone, for your time. I just wanted to leave a little bit of time at the end to help answer any more questions that we may have. You know, it was a lot of topics. Here we go. Is it important to have eyeglasses as well as masks? So that's an interesting question. I guess that would really depend on the level of interaction that you have, or what type of profession sometimes as well. If you're in the general community, if you're doing essential just grocery shopping or shopping, it may not be 100% necessary. Just a mask, wearing it appropriately, it's good. Eyeglasses, it can't hurt. It's another little barrier. But again, is it CDC recommended? Not necessarily. Again, healthcare professionals that are doing invasive medical procedures, examinations very close and intimate, like in someone's ear or examining their throat, they'd likely want to wear eyeglasses for protection. But just the general population, unnecessary, but it can't hurt. What I tell a lot of our patients is, if it gives you peace of mind and it makes you feel better, absolutely, absolutely. Okay. Okay, so I think those were all the main questions. I'll stop sharing the screen right now. Perfect. Alrighty, so I just want to say thank you to everyone again for your time this morning. Again, it's a privilege to be able to share some knowledge with all of you, and I really appreciate you taking the time out of your day to come learn. And then I hope that you'll be able to share with your community and our community at large this information, and hopefully, it'll be help us all. So thank you again. Thank you. All right, so with that, I think I'll say thank you and have a great day.